Currently, we are in Curitiba in Brazil. We are with the one who created the Hemostatic Net. They are also a brother of plastic surgeon. The first one is Dr. Andre Oswald and Dr. Luis Oswald. I have to brief a little bit because when these hemostatic net go to Thailand, we initially announced it's like a surgical net. But when people saw it like a spider web, they call it like a Spidey technique, and then they just call it Spidey net, and then they just changed to the Spidey lift. But today I would like to tell you about how it is really created. So we are with our two Brazilian colleagues, and they are led in these innovations, and we would like to ask him how does he created it and why.
Well, me and my brother, we are focused on facelifts, so we do most of our practice are dedicated to facelifts. And you know, as a plastic surgeon, that the most common complication in facelifts are hematomas, so are clots that accumulate under the flap or under the area that we detach after surgery. There are many reasons that this can happen because of nausea, vomiting, hypertension. There are so many other agitations. Some patients, they feel discomfortable, uncomfortable, and they may bleed. And this bleeding leads the patient to have another surgery. You have to open the area and remove this clot. So this happens very often to our practice because we do a very advanced level of facelift. So we start having a lot of complications like this. And at one day we were thinking, why instead of opening the patient, taking him to the operating room, opening and removing the clots, and then, washing, flushing out all those clots, we apply suture, external sutures, like we do in general surgery. If you have a bleeding, you put a suture in that bleeding, isn't it? It stops the bleeding immediately. So we start to apply multiple sutures. And what happened? It works very well. So that was our first case probably around 20 years ago. And every time we had a hematoma, we were treating like this is external separate suture. And one day I spoke to my brother, why don't we just put it preventively? Instead of treating the hematoma, we prevent the hematoma from formation. And from that day until today, we never stopped. We haven't had hematoma so far. And it's not only me, but many surgeons around the world is becoming more popular, the technique. They are very pleased because they don't have to worry about, hematomas. And that's the best thing about it. This is the first point. The second point, I think Luis can explain better, is about since we start, putting this suture, we notice another benefit from this technique that Luis can explain.
Yes, well, with the sutures, you fixate the skin over the muscle because during surgery, you detach the skin, you work on top of the musculature, and then you close and by placing the skin back on top of the muscle. But this skin can move around and it can sag and can glide in a way that perhaps you don't want it to glide. So you want to place it in a very desirable position. So you can, with these stitches, place the skin in the desired position that the surgeon wants. And that is the concept of the gliding surgery. So you glide the skin to the position where you want the skin to be. And because the time, 3 days that you leave the hemostatic net, 4 days sometimes, it is sufficient for the skin to adhere to the deep planes, and then you have a very nice skin accommodation, a skin redraping, as we say. We first aimed at hematomas, but as a bonus came the gliding concept, which is fantastic because that solves 2 problems at once. So it's probably what you experienced, too, because you have a lot of experience with the gliding surgery, right?
Yeah.
And what happened is that we have less edema, less chemosis, early faster recovery, So then the patients are very happy about this. So we have many patients that come for us just because of the hemostatic net. And another advantage, I think, since we started hemostatic net, it became very popular. I have seen surgeons from all around the world text me message. Thanks God that you create the hemostatic net because I was facing a difficult problem, patient that was bleeding on the table, I couldn't control, and I applied the hemostatic net and I quit it immediately. So you know that you probably have experienced situations like this one. But the good thing is that the surgeons now, they can rehydrate the skin in areas that we couldn't do, like the gliding brow lift elevate. You are a master on gliding brow lift, and we can rehydrate the skin on the cheeks and also on the neck. And the next step, the next generation of hemostatic net is in body contouring, that I have seen very experienced surgeons like Alfredo Hoyos, and so many, they are applying in HD liposuctions, gynecomastia, breast reshaping, and as well, you can name it, and also in reconstructive. So we have some papers published on applying the hemostatic net for reconstructive surgery, especially those surgeries, very difficult surgery that the patient sometimes you don't have time, or maybe patient don't come and you can apply some absorbable sutures and the patient stays safely for the entire recovery time without hematoma, and he doesn't need to remove the sutures. So it's fantastic.
Yeah. Can it be done internally, not externally? Like to put some sutures and like what you do in there?
Yeah, like barely. Yes, there's a paper published with internal sutures, but you can apply just 3 or 4 maybe sutures. You cannot apply more than 3 or 4. It's not enough to control bleeding. The hemostatic net, you apply maybe 200 sutures compared to 4 or 5. So the control of bleeding is much better with our technique, the hemostatic net. But it's possible. But you get markings, you can get dimples.
Yeah, I tried that and I got a lot of
dimples. So sometimes it's difficult to get rid of those dimples. So I wouldn't recommend this internal suture. I tried this too, but it doesn't work. The flap is too thin to put a suture.
Yeah, in my case too. How about hyperpigmentation? Yeah, a lot of Asian doctors, no matter how much I explain, maybe when you explain it, they believe it better.
You know where we live? Brazil, you have a lot of dark patients. Yeah, Brazil was colonized mostly we have a lot of influence from Africa, so we have a lot of dark skin and patients, and we operate on dark skin. We don't care about the skin color. If you have hyperpigmentation, it's going to be temporary. It's going to last 2, 3, or maybe 4 months. You just have to use skin blanches and explain the patient that it's going to happen and it's temporary. And it happens here in our country, maybe 15 to 17% of our patients have temporary hyperpigmentation that subsides within the first 2 or 3 months. But hypopigmentation, we also have European colony here in especially Curitiba, German and Italian. They are white skin, very pale skin. And if they have white spots on their arms or in their backs or maybe on their face, these white spots can happen with the hemostatic net. They are permanent, maybe tiny little white spots. Same can happen with the scars. You can get white scars, hypopigmented scars because of the maybe European descendants that these patients have. I swear, it's a very small number of patients that have this type of problem.
And the other question, okay, let's shift to some positive things. Can it reduce the scar of the facelift? Because it's like distribute the force here. Distribute the force, you put a lot of force into the hemostatic net, not so the force is already been here, so there is no force in the wound. Is it better quality of the scar? Yeah, this is opinion.
There is a concept in plastic surgery which is a progressive tension sutures. So it works somehow like you're progressively putting tension on the skin, but with somehow removing the skin distributing this tension on the head. And that's one of the appeals of the hemostatic net too. So much so that we don't usually need to anchor the skin around the ear as we usually did in the past.
Yeah.
So you distribute all the tension, and when you get to the scar around the ear where it's usually put, then you don't have tension anymore. So all the tension was put on the skin, but in a way that it was distributed. So that's one of the beauties of the hemostatic net too. I mean, you don't need to put very strong sutures on the edge of the skin incision.
Yeah, the incision, the quality of the healing is better with the hemostatic.
So you have reduced edema, you have less tension on the edges, and you have better quality of healing overall.
Another very important advance on hemostatic net with the hemostatic net was we went down deep on the neck. Yeah, when we do deep neck surgery, like you saw this morning, we're doing submandibular salivary blend, we move digastric plication, elevation of the hyoid bone, or so a high definition of the necks. That's what we do a lot in our practice. There's more discomfort postoperatively. So usually patients require more pain pills, which can cause more vomiting, hypertension. And with the hemostatic net, we are not concerned about this type of side effects of this medication. So we can go there, we can do the best for the patient, we can get the best result in terms of neck definition with no risk of hematoma perfusion.